The new Gene Zwozdesky Centre will be opening in fall 2023. This complex continuing care centre for seniors will offer hospice, day programs, and special units. And through education and training, it will also improve the operation of acute care and continuing care systems across our city.
We're really excited because the building itself is constructed, but now we're in what they call the commissioning phase. And then they have to do the training of equipment and training of staff and getting all the staff on board. So they're looking at having people moving into it in the fall. And then at that point, it will be functioning and we will have the center up and running. People will be in their new environment. People don't know what happens in a center like that until they've experienced it themselves. So more and more people are needing to be a part of this and become the community that supports that kind of a program and that kind of a center. And it's just going to be something that you see over and over in your daily lives now, where you know someone in a care center or who needs support in it because of dementia. By 2050, our senior population is going to be one of the highest it's been ever. And in that, our amount of people who are living with dementia is going to also be high. And so the need to really understand how to work with people, how to support them in their living, whether they live in a care center or they live at home, is going to be the highest need at that time. So it's really a crucial piece. We learn how to do and work with people, and that's why the center makes sense.
The Training Learning Research Center is intended to combine learning about dementia care and other kinds of care for our seniors with research about how to do that care as effectively as possible. So top educational researchers have actually identified that this is a gap. So it's a place where we not only need to provide that training, but we also need to help build the knowledge base about what that training looks like. So simulation labs are a way for healthcare professionals or any other learner in a healthcare environment to practice and try out new skills in a hands-on way without any risk of harming an actual patient or client or resident. Some of the simulations could include things like different team members working together with a person who has dementia. So the role of the person with dementia would be played by what we call a standardized patient. Standardized patients are really specialized actors who participate in these scenarios, who give that real-life experience to the staff or other learner who is working with them. And the beauty of simulation is that you can introduce all the elements that would occur in a natural healthcare environment. So it's really that real-life environment that gives the staff member or the other person being trained the most realistic experience. It is incredibly rewarding to see it start to come to life, and incredibly rewarding thinking about the difference that we can make. We can make a difference for healthcare organizations everywhere.
For somebody living with dementia, it really depends on the stage they're at. So can you just imagine being diagnosed with it and knowing what's ahead of you? How people interact with them changes. And that's what's really, really challenging for anybody that I've spoken to who's in early dementia. That's one of the hardest things, that people don't know how to interact with them and don't know what to do when they forget their words. And no person is the same. So it's when we're looking at our staff and what it's like to help our staff support the resident with dementia, we have to make sure that they understand that every single person is an individual, and how we support them in their daily lives is individual as well. And that's what we want to do with the Teaching and Learning Centre, is to have them work in a real environment where we use actors and have them react in a way that the staff doesn't anticipate. And then we can show the staff the different ways to react and show them how they've reacted and how they can change and learn and grow. And it's so important for that, because that really builds quality of life for our residents with dementia. It is quality of life the whole way through, and that's what we want for our residents in capital care, whether they're in the day programme, whether they're in continuing care or supportive living.
We have been fundraising for Stepping Up Norwood, and what we want to do is have people make donations towards this program, and particularly for our Teaching Research Training Centre, that we want to have funds that come in that support it now so that we can acquire the leading edge equipment that we want in the space. From a fundraising perspective, what we try to do is be the change agents to help the healthcare system get better, to raise the bar. And so as a change agent, we want to fund the things that make things better. And that's as simple as it gets. We just want things to be as best as they can be.
For more information on the new Gene Zwozdesky Centre, visit capitalcarefoundation.net.